Hi, this is Mark Reiner from Silent Inflammation Lab. Today I read peer-reviewed studies on forget inflammation tests. These 5 hidden signs reveal silent inflammation. Let me share what surprised me most. Right now, countless adults over 55 are unknowingly battling a silent enemy, chronic inflammation, stealthily eroding your health from the inside out. But here's what nobody is telling you about detecting it. This insidious process can lead to a 43% greater need for further care in certain situations, according to studies like one published in International Orthopedics. What I'm about to show you goes against everything mainstream health advice often focuses on, shifting your attention from abstract lab numbers to concrete daily experiences. Before we begin, this is not medical advice. I am sharing what peer-reviewed research suggests. Always speak with your doctor before changing your routine. We've meticulously reviewed findings from leading academic centers and institutions, published in prestigious journals like BMC Neurology, International Orthopedics, and Radiology. Today, we're revealing the 5 crucial hidden signs that could indicate silent inflammation is at play in your body, long before any standard blood test might flag it. Let's start with our 5th hidden sign, chronic fatigue. This isn't just feeling tired after a long day. It's a persistent, pervasive exhaustion that doesn't improve with rest, leaving you drained even after a full night's sleep. The mechanism behind this often goes unnoticed. Silent inflammation can profoundly disrupt your body's energy production pathways. When your immune system is in a constant state of low-grade alert, fighting off perceived threats, it diverts vital resources away from essential cellular functions, including the mitochondria, your body's energy powerhouses. This constant immune activation requires a lot of energy, leaving less for you to feel vibrant and alive. Research consistently highlights the debilitating nature of chronic fatigue. For instance, a study by Oliva Ramirez A., Keenan A., Kalau O., and colleagues, published in BMC Neurology in 2021, examined fatigue prevalence, noting it ranged from 36.5 to 78.0% in people with multiple sclerosis. While this study focused on a specific condition, it's finding that MS-related fatigue was consistently associated with significantly lower quality of life underscores how profoundly persistent tiredness can impact your daily existence. This principle extends to silent inflammation. Your body is effectively in a low-grade war, and that war consumes immense energy, manifesting as a pervasive sense of being worn out. Inflammatory cytokines, which are signaling molecules released during inflammation, can directly impact your brain, affecting neurotransmitter balance and disrupting sleep cycles, even if you feel like you're sleeping. This leads to a vicious cycle. Inflammation causes fatigue, and fatigue can exacerbate inflammation, making it harder to break free. But here's the catch. Fatigue is a common complaint, especially as we age, and it can be attributed to countless factors like poor sleep, stress, or even nutrient deficiencies. The key indicator for silent inflammation is when this fatigue is unexplained and persistent, lasting for weeks or months, and doesn't resolve despite addressing typical causes. It's not just feeling sleepy, it's a deep-seated weariness that impacts your ability to engage in activities you once enjoyed, making even simple tasks feel monumental. If you find yourself constantly dragging, struggling to find energy for daily life, and feeling like your batteries are always running on empty, it might be more than just getting older. It could be a subtle whisper from your body signaling underlying inflammatory processes. This silent struggle against inflammation can leave you feeling perpetually drained, robbing you of your vitality. On a scale of 1 to 10, with 10 being a definitive sign, chronic fatigue scores a 7 for silent inflammation. Moving on to our 4th hidden sign, persistent joint stiffness, particularly noticeable in the mornings. This isn't the occasional creak or pop. It's a stiffness that lasts for more than 30 minutes after waking, making it difficult to get moving and impacting your flexibility throughout the day. The mechanism here is that silent, low-grade inflammation can affect the synovial fluid and cartilage within your joints. Inflammatory molecules, known as cytokines, can contribute to the degradation of cartilage, the smooth, protective tissue that cushions your joints. This process is distinct from typical age-related wear and tear, which tends to be more localized and less persistent in its morning manifestation. When the joint lining is inflamed, it can produce excess fluid and trigger pain signals, leading to that characteristic stiffness and reduced range of motion. The impact of chronic joint issues, often exacerbated by inflammation, can be significant. A study by Haffer A., Go G.S., Fillingham Y.A., and others, published in International Orthopedics in 2022, found that patients who underwent revision total knee arthroplasty, RTKA, had poorer clinical outcomes and a greater need for further treatment, with as many as 43% of RTKA patients requiring further care, compared to 25% of other patient groups. While this research focuses on outcomes post-surgery, it highlights the profound and ongoing challenges associated with chronic joint problems, where inflammation often plays a foundational role in the progression and severity of the condition. Low-grade systemic inflammation can perpetuate a cycle of damage and repair that never quite finishes, leaving your joints feeling constantly tight and painful. This isn't just a mechanical issue, it's a biochemical one, where your body's immune response is subtly attacking its own tissues. But here's the catch. Some morning stiffness is considered a normal part of aging as cartilage naturally thins and tissues become less elastic. The key distinction for silent inflammation is the duration and severity of the stiffness. Is it lasting for a significant period each morning? Is it affecting multiple joints, sometimes symmetrically? Is it accompanied by mild swelling or tenderness that isn't due to an acute injury? If your morning ritual involves a prolonged period of stiffness and discomfort that takes a long time to work out, and this pattern is worsening or becoming more pervasive without a clear cause like overuse or injury, it warrants closer attention. This kind of persistent, unyielding stiffness is often a hallmark of an underlying inflammatory process that's quietly simmering beneath the surface. On a scale of 1 to 10, persistent joint stiffness scores an 8 for silent inflammation. Our third hidden sign is unexplained digestive discomfort. This isn't just an occasional upset stomach. We're talking about persistent bloating, excessive gas, abdominal pain, or irregular bowel movements, whether constipation or diarrhea, that don't seem to have a clear dietary trigger or resolve with simple remedies. The mechanism behind this often originates in the gut, which is a primary battleground for silent inflammation. When the gut lining becomes inflamed, it can lead to increased intestinal permeability, often referred to as leaky gut. This allows undigested food particles, toxins, and bacteria to pass into the bloodstream, triggering a broader immune response and systemic inflammation. This constant state of alert in the gut disrupts the delicate balance of your microbiome, the community of bacteria that aids digestion and nutrient absorption. When your gut microbiome is out of balance and your gut lining is compromised, it directly impacts your ability to properly digest food and absorb nutrients, leading to the symptoms you experience as discomfort. Furthermore, inflammation can impact organs critical for digestion and metabolic health, such as the liver. Research by Huang T.Y., Li Z.Y., Tianjie, and colleagues, published in Radiology in 2025, showed how specific imaging techniques were independently associated with liver steatosis and fibrosis, conditions strongly linked to chronic inflammation and metabolic dysfunction. While this study focuses on the liver, it underscores how internal inflammation can impact key digestive and metabolic organs, contributing to a broader spectrum of digestive issues. This low-grade inflammation in the gut and associated organs can lead to chronic irritation, sluggish digestion, and a feeling of constant internal upset. Your body is essentially struggling to process what you eat, leading to a cascade of uncomfortable symptoms. But here's the catch. Everyone experiences digestive upset from time to time. What distinguishes a potential sign of silent inflammation is the persistence and lack of clear cause. Are your symptoms recurring daily or nearly daily? Do they not respond to changes in diet or over-the-counter remedies? Are they accompanied by other symptoms like fatigue or joint pain? If you're consistently experiencing bloating, gas, or irregular bowel movements without a clear reason, and these issues are impacting your quality of life, it's a strong indicator that your digestive system might be under an inflammatory attack. This isn't just about what you eat, it's about how your body is responding to everything, and inflammation can turn your gut into a source of constant distress. On a scale of 1 to 10, unexplained digestive discomfort scores an 8.5 for silent inflammation. Our second hidden sign is unexplained skin problems, including persistent dryness, rashes, slow wound healing, or even an increased tendency for skin tears. Your skin is your body's largest organ, and it often acts as a mirror to your internal health. When silent inflammation is at play, it can significantly impact the skin's barrier function, its ability to retain moisture, and its regenerative capacity. The mechanism involves inflammatory processes that increase oxidative stress in skin cells, damaging collagen and elastin, the proteins that give skin its strength and elasticity. This leads to compromised skin integrity, making it fragile, dry, and more susceptible to damage and slower to heal. You might notice your skin feeling perpetually parched, even with regular moisturizing, or developing unexplained rashes that don't seem to have an external trigger and are resistant to topical treatments. The fragility of skin, often exacerbated by underlying inflammatory states, can lead to very practical and uncomfortable issues. A study by Silifo S., Basola B., Beekman D., and colleagues published in Journal of Tissue Viability in 2023 highlighted factors associated with skin tears, noting that certain hygiene practices, not applying leave-on products to moisten dehydrated skin, and even rough patient transfers could increase risk. While this research focuses on external factors, it underscores the vulnerability of fragile skin. Silent inflammation can contribute to this underlying fragility, making the skin inherently weaker and more prone to tears, even from minor friction or bumps. When your body is fighting inflammation internally, it prioritizes resources, and skin health, unfortunately, can take a back seat. This means less efficient repair, reduced hydration, and an overall compromised protective barrier. But here's the catch. Many skin issues can be external, caused by environmental factors, allergies, or simply aging. The key differentiator for silent inflammation is when these problems are persistent, widespread, or don't respond to typical external interventions. Are you struggling with chronic dryness that no amount of lotion seems to fix? Are you developing rashes without a clear allergen or irritant? Do minor cuts or scrapes take an unusually long time to heal? Or are you experiencing frequent skin tears from minimal trauma? If your skin feels consistently unhealthy, fragile, or inflamed without an obvious external cause, it could be a clear signal that internal inflammatory processes are undermining your skin's health from within. This isn't just a cosmetic concern, it's a sign that your body's largest protective organ is struggling. On a scale of 1 to 10, unexplained skin problems score a 9 for silent inflammation. Finally, our number one hidden sign of silent inflammation, persistent brain fog. This is more than just an occasional forgotten name or misplaced keys. It's a pervasive feeling of mental sluggishness, difficulty concentrating, memory issues, and a general lack of mental clarity that impacts your daily functioning. The mechanism here is what we call neuroinflammation, inflammation within the brain itself. Silent systemic inflammation can lead to inflammatory markers crossing the blood-brain barrier, activating glial cells, which are the brain's immune cells. When these cells are chronically activated, they can release their own inflammatory substances, creating a low-grade inflammatory environment that impairs neuronal function, reduces blood flow to the brain, and disrupts the delicate balance of neurotransmitters essential for cognitive health. This chronic inflammatory state in the brain can directly impact your ability to think clearly, process information, and recall memories. Research published in Brain, Behavior, and Immunity in 2022, among other studies, highlights the intricate connection between systemic inflammation and brain health, emphasizing how inflammatory processes can contribute to cognitive decline. When your brain is constantly battling inflammation, it's like trying to think through a dense fog. Information processing slows down, memory retrieval becomes challenging, and maintaining focus feels like an uphill battle. This isn't just an inconvenience. It can significantly affect your independence and quality of life, making it hard to read, follow conversations, or manage complex tasks. Your brain is a highly sensitive organ, And even low levels of chronic inflammation can have profound effects on its function. But here's the catch. Occasional forgetfulness and slower processing speed can be a normal part of aging. The critical distinction for silent inflammation is when brain fog is worsening, pervasive, and significantly impacting your daily life. Are you consistently struggling to find words? Do you find yourself unable to focus on tasks you once handled easily? Are you frequently feeling mentally exhausted or fuzzy? If this mental cloudiness is persistent, doesn't improve with rest, and feels like a fundamental shift in your cognitive abilities, it's a powerful indicator that silent inflammation might be affecting your brain. This isn't just about feeling a little tired. It's about your mind feeling less sharp, less clear, and less capable than it used to be, pointing directly to internal inflammatory processes that are quietly affecting your most vital organ. On a scale of 1 to 10, persistent brain fog scores a 9.5 for silent inflammation. So there you have it, the 5 hidden signs of silent inflammation that are often overlooked. Let's quickly recap them in reverse order of their revealing power. At number 5, we have chronic fatigue. That persistent exhaustion that doesn't lift with rest. Coming in at number 4, persistent joint stiffness, especially in the mornings, lasting more than 30 minutes. Our third sign is unexplained digestive discomfort, including chronic bloating, gas, or irregular bowel movements. At number 2, unexplained skin problems, such as persistent dryness, rashes, or slow healing, including skin tears. And the number 1 hidden sign, often the most impactful, persistent brain fog, a pervasive mental sluggishness and difficulty with memory and focus. Now for a challenge. For the next 30 days, I want you to become a detective of your own body. Start observing these signs. If you have skin issues, take a photo today. Note down your fatigue levels, track your digestive symptoms, and pay close attention to your mental clarity. In 30 days, take another look. You might be surprised at the subtle but significant changes you notice as you become more aware of these hidden signals. Your body is always communicating with you. It's up to us to listen. If this video resonated with you, please give it a thumbs up and subscribe to the Silent Inflammation Lab for more deep dives into optimizing your health. Don't forget to hit that notification bell so you never miss our insights. Understanding these hidden signs is the first step towards reclaiming your vitality and living your best life after 60. Stay tuned for our next deep dive into optimizing your health from within. If this changed how you see this topic, consider subscribing. We're quietly building a library of research-driven explorations into how aging actually works inside the body and how the simplest daily choices may matter more than the most complicated supplements.